Hello, so today we're going to be performing a nutrition-focused physical exam. When performing an exam, we want to start from the top and go down to the bottom. We also want to observe the right side from the left side to see if there are any differences between the two. We want to start by introducing ourselves. So hello, my name is Kayleen and I'm the dietitian that you will be working with today. And before starting the exam, we also want to ask for permission. Is it okay with you if we perform the exam today?
Yes.
Okay, so from that handshake, I can already start the exam. I can check to see the hand strength that he has. I can also check the temperature of his skin and to see if his skin is dry or not. If his skin is dry, then I can already tell that he might be deficient in essential fatty acids. Next, we're going to check the hair. So we want to check for any bald spots, and we also want to tug on it. If the hair comes out easily, that may be a problem due to malnutrition. And we can also ask the patient if they've had any hair loss recently. Next, we want to go to the eyes. We want to check the orbital area to see if there are fat pads. If it feels like it's a bit hollow, this may be a sign of malnutrition. We also want to check the temporal bone for any wasting, and we also want to check the eyes for dry patches. When doing the eye exam, you also can use a pen that has a light so you can check their eyes. So next, we're going to perform the oral exam. We can ask the patients if they can smile for us. Can you smile for me, please? Okay, so it looks like he has movement of the mouth and he didn't have any troubles moving the mouth. You can also ask the patient to see if they've had any problems chewing or swallowing. And you can also ask them to open their mouth. So what we're doing here by placing our hand under the chin is checking to see if they have strength under their chin when they're opening their mouth. We also want to ask them to check the inside of the mouth. So when we're looking inside the mouth, we're checking for a dry mouth or any sores. A dry mouth can be a sign of dehydration. And we also want to check the lips, the corners of the lips, if there are any cracks. We're going to check his teeth. We want to check to see if he has any missing teeth. If he has missing teeth, then we cannot assume that he's having troubles eating, because sometimes patients who do have missing teeth have no troubles eating. So we'll check the mouth. Open your mouth, please. And we see that he has a full set of teeth. And also, if the patient has a full set of teeth, we don't want to assume that they don't have any problems chewing. So we still want to make sure that we're asking if they have any problems chewing or swallowing. So when we're checking the mouth, we also want to check the tongue to see if it's dry or to see if it has any sores. Okay. And next, we want to check the clavicles. So what we're checking for here is for hollowness. So if it's too hollow, that may be a sign of malnutrition or wasting. We also want to check the bones of the arms. So if it's too bony, this may be a sign of malnutrition, but we want to make sure that this is not their normal state of being. So we want to ask the patient if this is how they usually are or if they've experienced weight loss. We can also lift the patient's arm and have it at a 90-degree angle. So when we do this, we want to pinch the bottom. So here, there's enough for me to pinch through without feeling my fingers. If I could feel my fingers through his skin, that may be a sign of malnutrition or wasting. So when we're performing the exam on the arms, we also want to check the nails. So we want to check the nails to make sure that there's no spooning going on. This may be a sign of iron deficiency anemia. We can also check for color change. If it's blue, it can be a sign of clubbing. If the nails have ridges, then this can be a sign of protein or energy malnutrition. So his nails look great. And we can also press on the nails to see a color change. That means that the capillary refilled quickly if the color came back fast enough. So when we're performing this exam, we also want to check the skin to see if it's dry or flaky. This can be a sign of essential fatty acid deficiency. We also want to pinch the skin. So when we pinch the skin, we just want to check to see how fast it bounces back. This is a sign of hydration status. If it bounces back really quickly, that means that he's well hydrated. If it takes a long time to bounce back, that means he's dehydrated. So when we're going through the body, we want to check the lower body as well. So here we want to check his ribs to see if there's any hollowness or any wasting. It looks like there's enough for me to pinch, so he doesn't have any wasting going on. We can also check the hip bones to see if there's any wasting. And we also want to check the quads when we're doing this. So what we're looking for in the quads is muscle wasting. And we also want to make sure that we're checking both the right and left. And we can also perform this on the calves. So a patient can be experiencing edema, so that can be swelling going on throughout the body. We want to check the lower body if they are moving around. Typically that's where it'll be seen. So for swelling, we want to push in on the patient to see the dentation going on. Depending on how bad it is, we can rate it on a scale of 1 to 4. And now when we're performing the nutrition-focused physical exam, we also want to check the GI tract. So what we can do is listen for any bowel sounds or listen for any movement, and then the GI tract is cut into 4 quadrants. The abdominal area is cut into 4 quadrants, so depending on what we're looking for, we'd go and listen to that area. And that is it for today's nutrition-focused physical exam.